Good afternoon. Our next presentation is from Newtopia. The presentation will be given by Newtopia's CEO, Jeff Ruby, followed by a 5-minute Q&A session. Please make sure that if you have any questions, you send them through. Don't wait till the end. And they will be sent to me anonymously. So there's lots of time for questions near the end. And it's at the bottom of your screen. Anyways, Jeff, it's our pleasure to introduce you. Thank you very much for presenting at our conference. I'll bring it over to you now.
Terrific. Thank you, Andrew. It's really wonderful to be back at Burton and to provide an update on what's been some remarkable progress. I'm Jeff Ruby, founder and CEO of Newtopia. And just to get started, Newtopia is a tech-enabled habit change provider helping health insurers prevent disease and save cost. By bringing together the best of human with the best of digital, our platform really incrementally builds and stacks healthy habits around nutrition, exercise, and mental health. Now, that may not sound that revolutionary at first, but it's a real paradigm shift when you consider the dominant sick care system, which is really focused on monetizing illness instead of a focus on keeping people healthy. By working with some leading innovative employer health insurers in the world, including CVS Health, JP Morgan Chase, Accenture, and Levi's, to name a few, we focus on the 80% of the insured population who've got elevated risk for chronic disease and skyrocketing cost. And as a provider of whole person care, our focus is on reducing both physical health risk and mental health risk, all tied to a performance-based model that is proven to be profitable and self-funding to the health insurer inside the first year of deployment. And best of all, we're delivering outcomes that grow over time so that everybody wins. So how did a JD MBA with no health background like myself find myself here? Unfortunately, I lost my father to cancer at a young age and came to the realization that what we call healthcare has very little to do with keeping healthy people healthy and has almost everything to do with monetizing illness. Our wonderful physicians, healthcare workers, hospitals do marvelous things when it comes to diagnosing, prescribing, and treating illness. But they don't offer primary lifestyle prevention, and they don't help individuals adopt new and healthy habits. By failing to do so, it leaves the health insurers, whether employers, private insurance companies, or governments, intervening too late in what is an entirely unsustainable system. And I felt really compelled to do something about that. It led to a whole new approach to healthcare, one that's focused on a preventative habit change system called Newtopia. Now, to understand the way the two systems work, the focus on sick care and the lack of primary prevention is the same in Canada and the US. What really differs between the two systems is who pays for it. And it's that who pays that really signifies who innovates and where our value is added. Now, quickly, in Canada, core health insurance is taxpayer funded and is paid for by provincial health insurers. There is some supplemental insurance offered by private insurers and employers, but the real meat and the pain on paid medical is felt at the provinces, and any move to prevention is going to happen at the provincial level. That really leaves insurers and employers off the hook to meaningfully innovate, to demand outcome-based outcomes and ROI. And employer paid benefits here in Canada are really provided because they're nice to have. They are really seen as a nice fringe benefit, but it could not be more different in the US. In US sick care, to the tune of $3.7 trillion a year, is not value-based. It's paid for by 3 different types of insurers. You have large employers that self-insure, covering about 140 million Americans. You've got private insurers like Blue Cross Blue Shield, United, Aetna, Anthem, covering the small employer and individual market, covering about 100 million people. And then you've got the government through Medicare, Medicaid, and the VA, covering another 100 million. Now, the cost of healthcare in the US has been rising for decades, approaching about 18% of US GDP, compared to about 10% here in Canada. Now, the group of insurers that feel the pain the most in the US are those self-insured employers, because they are totally responsible for the cost of healthcare for their entire employee base. And because of that, they are really forced to innovate through novel plan design and from the benefits that they offer. Unlike in Canada, employers are offering the full ride, and they're using their health benefits and insurance coverage as a way to attract, retain, and to reduce costs. And it's that group that we started to work with the first. The way that we help is by focusing on reducing key metabolic risk factors. There are 5 specifically, including waist circumference or BMI, blood glucose, blood pressure, triglycerides, and cholesterol. As those risks go out of range, so too does the risk of developing chronic diseases like obesity, type 2 diabetes, heart disease, and stroke, which are connected to a whole host of other costly and life-threatening ailments. But the challenge for health insurers is that as those risks go out of range and there's a breakdown in human health, there's also a jump in cost, where today a healthy member or employee should be about $3,400 per year in US dollars. The challenge is that 80% of the population has at least one out of those 5 risks out of range, which leads to a 40 to 60% jump in cost. What makes that risky period so scary is that within a short time, a $5,400 at-risk individual could spike by 3 times and become a $15,000 a year type 2 diabetic, or spike by 4 times to become a $20,000 a year cardiovascular disease. And that's a pretty terrifying unmitigated liability when you consider that that's only the physical health risk side. As the breakdown in human health goes on, we know that there are corresponding increases in both mental and emotional health costs above that. Now, it's this red zone that is the domain of so-called healthcare today. This is where our physicians, our hospitals, our health systems, even telehealth is really focused. And we think the effort is focused in the wrong place. We think there's a greater opportunity to look not at the 20%, but at the 80% who are coming up that risk curve and really work through habit change to bring down those costs. And what we've proven to be able to do is take someone in early red and orange, bring them back to green inside of a year, do it profitably to the health insurer, but most importantly, deliver outcomes that grow so the benefits to the individual at risk, to the health insurer, and to Newtopia grows. And that's the greatest value that we can offer. A flip to prevention from our dominant sick care model represents a massive market opportunity. Just applying the 80% at risk across Newtopia economics today, it's over a $500 billion opportunity to Newtopia alone. COVID-19 has been a remarkable lightning strike for individuals and for health insurers. On the challenging side, it certainly has had an impact on some standard operating procedures amongst the employers that we work with. It's had an impact on risk identification, delayed some of the focus on some implementations. But there's also a tremendous opportunity side as well, in that the entire world is focused on preventing disease like never before in our lifetime. Number 2, this incontrovertible proof connecting pre-chronic disease risk, things like obesity, pre-diabetes, pre-heart disease, and COVID-19 as the second leading risk factor and a huge cost accelerant, which health insurers are paying attention to. And then third, what has been underreported is the very likely tsunami of chronic disease that follows COVID-19 when you consider the social isolation, poor eating, inactivity, mental and health stress that we continue to endure through this. And it's something that health insurers are aware of and are going to have to focus on their at-risk population in a way they never have before. So how does it work? What we're doing is leveraging existing risk identifiers that 95% of employers are using today. They could include a biometric test or a health risk assessment or an online risk screener. And what we're doing, keep in mind, these are voluntarily taken. And so individuals are voluntarily taking this, and this is where we get their information and then have permission to communicate with them. What we're doing is really playing on timing. As these individuals at risk learn they've got a greater chance of having a heart attack or a stroke or developing a chronic disease like diabetes, they're going to be concerned. And that's when we want to intervene with an invitation to participate. Today, we're seeing between 25% up to 60% if the incentives are right of that at-risk population participate and join our platform. Meet Mary, as she has now accepted the invitation from her employer to join the Newtopia platform. Our habit change methodology kicks in immediately. We first want to take the time to learn about Mary holistically. And so we want to learn about her socially, behaviorally, and genetically. We're pioneering an area we've called genetic engagement, which is really all about helping Mary understand herself so we can arm her with a greater sense of control and motivation. We then leverage that learning to build a meaningful habit change experience for her that's virtual. It starts with human, where we use behavior science, much like a Match.com, to match Mary to a trained member of our team called an Inspirator. We then want to configure the right habit change recommendations across nutrition, exercise, and mental health for her. It's all extended through fantastic technology. Her entire plan is going to be provided on a custom app or web portal. And then we're going to leverage fantastic smart tools and technology. Mary's going to get a smart scale or an activity tracker or a blood pressure cuff or a continuous glucose monitor, depending on what she needs to be successful. We go further and ensure there's the right gaming to keep it fun for Mary and the right curated social health network to keep her engaged and motivated. Key to all of this is this one-size-fits-one focus. And it's really about us putting Mary in the center and becoming a student of Mary, and then leaning on habit change, where we expect at the end of 12 months, we're going to have an improvement across physical risk reduction, mental and emotional risk reduction, that is going to be self-funding and profitable to the health insurer, but that grows over time. So we see improvements at 12 months and at 36 months. And it's that way that we offer the greatest value to Mary and to the health insurer. The leverage in the business comes from our virtual care platform. It's this fantastic technology that's bringing together the right technology, user experience and design, the right behavioral economics and psychology, the right data analytics, more and more AI and deep learning and smart automation. And it's this technology that's letting us deliver that habit change for not just Mary, but the millions of Mary at scale. And what it does is it lets us manage and optimize a key KPI for Newtopia, which is how many Marys can any one of our Inspirators manage at a time? Today, we operate at a 1 to 200 ratio. In doing so, we're driving 60% margins on our monthly recurring revenue. We believe that by adding more smart technology, which we continue to invest in, we can move from that 1 to 200 up to optimally 1 to 350 or even more, and move from 60 points of margin up to the mid 70s, which is what we're investing in today. How do we know it works? Well, prior to commercializing, we wanted gold standard evidence of the efficacy and cost savings of the platform. And we partnered with Aetna to conduct a 3-year randomized control trial that was published in the Journal of Occupational and Environmental Medicine. At the end of 12 months, the study demonstrated that we were able to improve physical risk factors, all 5 metabolic risks at the end of 12 months, that corresponded to a $1,464 savings in paid medical costs. On an average spend of about $700 per engaged participant per year, Aetna was able to experience a 2x in-year ROI. We paid for ourselves within the first year alone. That's as good as any result that's been published in the peer-reviewed literature about a prevention program. But it's actually what we achieved between 12 and 24 months that we're most proud of. Because as a habit change platform, we're looking for outcomes that grow. And we saw our outcomes double from 12 to 24 months. It's significant because Mary's getting better, her outcomes are improving over time. It's significant because the 2x ROI we delivered for Aetna at the end of 12 months becomes closer to 4 times at the end of 24 months. And it's significant because look at this gray line here. This is what everyone else is offering in a one-size-fits-all learning and education course, which has its peak at 16 weeks and then goes down from there. We've been able to replicate these outcomes and improve upon them in our commercial book of business, but also we've been able to move away from strictly focusing on physical health risk to also improving mental and emotional health risk, resilience, and performance, which are all really important for value for our health insurer partners. We leveraged the experience and learning from a randomized control trial to create a novel performance-based business model. I'm going to walk through how it works. Keep in mind that the health insurer or employer pays for all 3 components. First, as Mary joins the Newtopia platform, the first thing that we do is send her a welcome kit. We're going to bill her employer $230 for that kit. It includes everything she needs to be engaged and sticky. There's about 25% margin there, largely passed through on purpose. Again, we really want to set Mary up for success. Then number 2, for every month that Mary is engaged with her Inspirator or with the technology platform, we're going to bill her employer $65 per month on a recurring basis. We're driving 60% margins on that $65 today at that 1 to 200 service ratio, with the opportunity to grow as we improve upon the technology that we're investing in. And then number 3, If at 12 months, Mary has achieved a clinically significant risk reduction milestone, today that's set at 5% body weight reduction, we're going to bill Mary's employer an outcome milestone or a success fee of $200. We know at that 5% that we will have improved all 5 metabolic risks, we will have improved both the mental and emotional health risks, and we will have triggered that $1,464 in paid medical cost savings. And so this is our opportunity to participate in some gain share. If you take those 3 components and apply 6 years of pretty consistent churn data, we are confident in collecting a conservative $1,600 for every Mary that joins the platform over 3 years on an average recurring revenue basis. And I say that's conservative because it's based on the length of the randomized control trial. We actually haven't discovered the terminal end of our revenue tail, and we have engagement now after 60 months and going. So lots of room for improvement. From the commercialization standpoint, as I pointed out, we really wanted to go to where the innovators were. And so we started commercializing with some of the most innovative employers in the world. Today, our employer contract base represents 840,000 total lives, of which 50% conservatively are at risk and addressable. If you multiply that by 18%, which has been our historical conversion rate since we began commercializing, there are 75,000 potential Marys for us to work with. Applying the $1,600 average recurring revenue over 3 years, that brings it to $120 million in potential revenue opportunity in what we sold alone. And that could grow significantly if we're able to expand beyond the 50% to the broader 80% or improve that conversion ratio, which we're working on to do both. What's really important to note is that we phase into each of these clients, either geographically or divisionally. And today, we phased into roughly 20% of that contract capacity, meaning there's a 5x opportunity to grow to fill our cup, if you will, just from the contracts we sold alone, if we were to stop, and not sell any other clients, which we have an incredibly rich pipeline. One of the biggest strategic advantages and growth opportunities for Newtopia is the data that we collect. Consider, for every Mary that joins the platform, we have full access and research and development rights to her entire genomic sample, plus 3+ years of really rich lifestyle and behavioral data, which is otherwise known as phenotypic data. Now, it's important to note our ownership rights extend to anonymous data, not personal health information, but it's really valuable for data analytics, and it's really valuable for R&D. On the data analytics side, what we're able to do is apply more and more of our platform AI and machine learning to offer novel insights back to Mary to keep her engaged and sticky, which helps our core recurring revenue model. But I believe the greater value is in the R&D side. As we scale this data, there's an opportunity for us to partner with drug discovery and pharma companies on what we believe can be a next generation preventive therapeutic platform. Effectively, how do we marry Newtopia's proven habit change platform with precision medications for lowering blood glucose, blood pressure, triglycerides, etc. Now, we have not begun to commercialize the R&D side, but we believe it represents massive upside for Newtopia investors. I put together a world-class leadership team from the US and Canada with the experience and passion to be able to scale the platform. We also have an industry-leading board of directors and industry-leading commercial advisory board supporting the growth of Newtopia. On the financial side, we've seen annual revenue growth fairly consistently at nearly 100% year over year since we began commercializing in 2016. We did experience some impacts from COVID-19, delaying as standard operating procedures slowed down some risk identification and some phasing that had some impact on us in late 2020, early 2021. But we see a full return to normal standard operating procedures and our traditional growth ramp in the second half of 2021, and we're really excited about it. On the engagement side, our core recurring revenues are represented here in tremendous and consistent growth from 2016 through to 2020, which we anticipate will continue, especially as organizations get back to standard operating procedures in the second half of 2020 and are focused on mitigating this risk of both their at-risk participants and what COVID-19 has presented. From a growth driver perspective, there are three key growth drivers for Newtopia to be aware of. The first is increasing enrollment. As I mentioned, we are only 20% penetrated into a contract base worth of about 75,000 potential participants and $120 million. So our opportunity to continue growing there is key. There's also the opportunity to improve that conversion ratio. Notably, I mentioned 18%. It's worth noting in our latest work this past year with JP Morgan supported by Haven, we saw conversion rates of closer to 60%, just to give you an indication of the improvements that we're making. The second is improving product density. Here, this is the focus on how do we get beyond the 50% toward the full 80% of the population at risk. And what we're focused on in this area is really the full whole person care spectrum, prevent, reverse, and slow, while enriching mental and emotional health, improving resilience, and improving human performance. And then finally, there's an opportunity to expand our client base. We began focusing strictly on the self-insured employers. The 840,000 lives under contract represent 1% penetration into the 140 million US lives that are covered by self-insured employers. So we've really just gotten started there. We also have efforts underway to tap into the private insurer market, into their fully insured book, and on the public and government insurers in the US. We are beginning to approach Medicare and Medicare Advantage on the back of a really fantastic paper we published at the end of last year, suggesting a $1,700 per member per year savings, as well as some work that we're doing in Canada to try and support provinces who are trying to reduce their risk as well. So, tremendous growth opportunities in all three of these drivers for Newtopia. As I sum it up, this paradigm shift is in the early innings. We've got a massive addressable and growing market. It's easily scalable virtual care platform that we're offering with proven financials and clinical outcomes. Marquee insurer clients that continue to grow. We're collecting some of the most valuable genomic and phenotypic data there is. We've got a highly experienced management team, a recurring revenue model that provides great predictability. And ultimately, we believe the future of healthcare is prevention and a focus on keeping people healthy, not on managing sick. And ultimately, Newtopia represents that new front door to that system. Thank you.
Thank you, Jeff. That was terrific. So we have some questions that have come in, and I'm wondering if you could let us know what the disbanding of Haven has done and the impact it's had on Newtopia.
Sure. It's a great question. The short answer to the question is it's done very little. We were incredibly fortunate to have had the opportunity to work with Haven as they were around in the 3 years that they were around as a separate entity. We are the only project that they worked on in the JP Morgan market, and we came through a full 12 months of one of the most valuable innovation partnerships we've had to date. We've been able to present our outcomes back to the consortium members within the last couple of weeks. And so we're really excited about the outcomes we've generated. But more importantly, if you've been reading the news as of late, the word on the street is that Haven didn't disband, Haven moved indoors, and that all three entities continue on the innovation side with Amazon, Berkshire, and JP Morgan really focusing on health technology and innovation for their populations. And so we feel we're incredibly well positioned and feel blessed to have had the opportunity to work with them.
Terrific. And Jeff, have you had any pilot projects that did not get converted into full rollout? And maybe you can describe, why it did not happen.
No, we've never had a pilot project that has not moved into full rollout. Thus far, everything that we've begun has continued along, with the exception of some of the earliest clients that we may have won through our Aetna sales channel in the early days, who we actually fired ourselves from because we probably should never have been there to begin with. But no, we've only seen growth. A great example, we started with Aetna back after our randomized control trial, grew into their enterprise as they were acquired by CVS. They brought us to CVS. JP Morgan, we started there as the Haven project. They brought us to Haven, and now are bringing us to this new innovation partnership that's forming within JP Morgan. And so, thus far, our trajectory has been really positive.
Terrific. Jeff, Newtopia's done an incredible job penetrating the U.S. market. It's unbelievable that you're able to start this company at Young and York Mills, and you're working with some of the top companies, Fortune 100 companies. Can you describe the sales cycle and also be specific about what departments and teams get involved in making the decision?
Yeah, it's been a really it's been an interesting journey learning about how to do this enterprise selling. As I alluded to before, we started after our randomized control trial in 2016, relying on Aetna as a distributed sales channel. I thought at the time that was going to be a phenomenal opportunity to have their 400 plus national account salespeople selling Newtopia. The lesson learned was actually that the innovators in the market who we really needed to go to weren't counting on Aetna or any of the private payers for that innovation. Rather, they were really counting on the benefit consultants and brokers or a small band of innovation brokers. And we moved from a distributed sales approach toward direct selling, primarily an influencer strategy. We understand that we're going after influencers and we're trying to find out who influences them. And that's primarily the Mercer, Willis Towers Watson, Aon brokers in the market who we work extremely closely to get introductions, or a small band of innovation brokers. And who we're directing ourselves to is either the CHRO or head of benefits within these large self-insured employers.
Thank you. And as you look to grow your customer base, do you see the comprehensive platforms like Dialogue, Maple, as competitors, or as a point of solution or a point of solution? And so are you threatened by these broader solutions, or do you feel like you could partner with them?
No, I mean, first of all the names that you mentioned are really focused on, primarily the Canadian market, not going after the Fortune 500 U.S. employers, as I'm aware today. And we don't see ourselves at this point in time having a tremendous opportunity with Canadian employers or the direct-to-consumer, simply because of the dynamics I mentioned at the outset of the presentation. It's just the economics here and where the pain is. So the answer would be, a huge fan of all these platforms and a huge fan of telehealth and telemedicine and telemental health, but I would still contend that they are focusing more on the red sick care side, and they're digitizing what's the status quo, as opposed to what we're doing, which is really the next generation of offering that same virtual care platform, but focusing on a group that has not been focused on by sick care, offering that primary prevention and really moving down the risk. And so I guess the long answer is, whether it's the platforms that are forming in the US or Canada, we see them as partners. None of them are delivering the kind of outcomes or the kind of risk-based models that we offer today. Terrific.
And is there anything you can share regarding the user or client retention?
Yeah, it's been rather outstanding. I can give you a sort of a sense. I ran you through our bit at the top of the funnel through the presentation. Today we're seeing anywhere between 25% up to 60% of the at-risk audience take us up and join the platform. Again, the incentive structure really helps to shape whether we're closer to the 60 or the 25%. Our latest work with JPMC and Haven was at closer to that 60% mark, which is really exciting as a direction forward. Once Mary joins the platform, we expect Mary to be 70% of Mary to be fully retained through the end of 12 months, which drops to 50% through the end of 24 months, which drops to 45% through the end of 36 months, and then drops to 40% through the end of 48 and 60 months. So we have 40% of our participants that started fully retained through 5 years. And I'm not aware of anyone else that has that kind of stickiness or that kind of engagement record on a broad-based lifestyle and habit change prevention program.
And can you talk a little bit about your major competitors, and is there any big players like Weight Watchers in the corporate market that you're starting to compete against?
Yeah, so look, I would say there would be some competitors in the weight management side, probably the Weight Watchers and Noom, that are really focusing on lose some weight quickly. Lots of respect there, and they've been here since we've, they've largely been here since we've emerged in the market as well. There are some other players, mainly the condition management side, groups like Omada Health, Livongo to the extent that they focus on prevention, LARC, and and Vita, most of those players are focused on condition management. They're focused on the red zone, managing people with diabetes or with cardiovascular disease. Some of them dabble in prevention, but as they dabble in prevention, what they're all doing, especially around diabetes prevention, is that they have adopted the CDC's standard diabetes prevention program, which is the same as a college level course. It's like Lifestyle 101. It's 16 weeks, the same for everyone, and they've appified it. So they're all offering a commodity, but at best they're offering that gray line, right? Their outcomes get there at 16 weeks, kind of helps to make you smart, but then all the results come down. And I guess the real question is just think of a course you've ever taken in your life that not only made you smarter, but that changed the course of your daily habits every single day. And if you can't think of one, it's because you haven't taken one. And it's why that is going to fail for the 100 million people who are at risk for diabetes today in the United States and the equivalent group if it comes to Canada as well. It's the wrong mousetrap. It's not for behavior change and habit change. It's just teaching information.
Well, Jeff, this concludes our session, but I just want to thank you very much for participating today. And it's remarkable with what you've been able to achieve, especially as a Canadian company getting into the U.S. That is amazing. So the session is now over, and a replay of this presentation will be available for up to 24 hours after the conference. And to access this replay, please visit the main agenda page. The next presentation in track 1 is New Path. Track 2 is Perimeter, and track 3 is Inversago. And to access the next presentation, you'll need to go back to the homepage or the main agenda. Jeff, thank you very much.
Thank you.